Welcome to another episode of the Say Goodbye and Imagine podcast. Thanks for joining us. We have such a great topic today because we're going to talk about the neurobiology of alcohol use disorder and how it progresses and what is going on in your brain and when it turns into something called addiction, where you need medical attention. And we have an expert here to talk to us about that today. Her name is Dr. Holly Geyer. Did I say that right?
You nailed it.
Thank you. And, before we get started, I have a little disclaimer whenever I have a medical professional on the show, and I want to say that the content of this podcast is for informational and educational purposes only. The views and opinions expressed are those of individual guests and do not constitute medical advice. Always seek the guidance of a qualified healthcare professional with any questions you may have regarding your health, medical conditions, or treatments. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. I also want to say that if you are enjoying the information that we are relaying to you, to make sure you like it, you follow it, and you share it. That is how more people find out about this important subject. So, our guest today is an associate professor of medicine and consultant in the Division of Hospital Internal Medicine at Mayo Clinic in Phoenix. She is dual board certified in internal medicine and addiction medicine and serves as chair of the Opioid Stewardship Program at Mayo Clinic in Arizona, as well as serving as the medical director of occupational health. She is the author of the newly published Ending the Crisis, Mayo Clinic's Guide to Opioid Addiction and Safe Opioid Use. Dr. Geyer's research focuses on safe use of opioids and the impact of various treatment regimens on patient quality of life, particularly in cancer populations. She has given presentations both nationally and internationally and has authored more than 120 journal articles, book chapters, and abstracts. She also serves as a reviewer for prominent scientific publications. She has experience serving on Arizona Medical Association Legislative Committee and has assisted with state law opioid policy development at both the Arizona Department of Health and state legislature levels. And welcome, Dr. Geyer. It is so nice to have you.
Roseanne, you accidentally got a hold of the long bio. That one's for medical conferences. We got a much briefer one that gets to the heart of the issue for our general audiences, but I'm so pleased to be with you today.
Yeah, so Dr. Geyer and I met at a conference for parents of addicted loved ones, and I really connected with a lot of what she was sharing, even though her experience is in primarily opioid. I have an issue today with that word, addiction. You know, the addiction problems look the same in a lot of areas. As a matter of fact, I don't know, you might not know this, but I'm working with Dr. Carl Benzio. He's the medical director of the American Association of Christian Counselors. And he's we're updating my devotional for all life interfering behaviors because he's like, Roseanne, this is not just alcohol. This is applicable to a lot of things. But the compassion that you shared, the information that you shared, and how the brain is rewiring as we go up this spectrum of substance use disorder to full-blown, you need medical intervention. And I think we want to educate people about that because would I be wrong if I said it looks the same across all addictive behaviors, or is it a little?
Some modifications between the different disorders, but holistically, the same concept is the same. It's use of the reward pathway, hijacking of it, and then control over that person.
Right. And I did end up reading this wonderful book for anybody who cares about this subject matter. It's called Ending the Crisis, Mayo Clinic's Guide to Opioid Addiction and Safe Opioid Use. There is so much valuable information in there. And I just want to start with quoting something at the beginning of the book that really connected us. And it's that you said, "We wrote this book because our world has been fighting the wrong battle. It's time to move our focus away from the battle against opioids and focus instead on the real needs of people affected by the drugs." And do you want to just give an overview? Because I feel like that goal is one that I share, right? It's we're fighting the wrong battle. It's not about the alcohol. What do the people need um, to
Yeah.
solve this problem? So I'd love for you to expound on that.
You're so right, Roseanne. You know, if we take a look a bit at my own background, I think it explains a lot of how I ended up with many of the viewpoints I have on this topic, which I will say align very nicely with those of the national societies on this, particularly the American Society of Addiction Medicine. And many of their publications to the general public have not gone over well, right? We've changed the concept of addiction from being a behavioral disorder to something really driven in biology. And for most of us, right, as lay people, what are you talking about, right? Johnny makes bad decisions. Johnny doesn't come home at night. Johnny chooses to use drugs, and probably because he doesn't love me anymore. I've heard every one of these comments, Roseanne. And what I want to do today is really give people an understanding of how we came to our understanding of what that biology is. I grew up in the addiction treatment world. My parents were missionaries in South Africa, and I grew up working over in South Africa with them on the mission field. We were in shanty towns in the middle of the apartheid back in the 1980s. And I saw deprivation at its best. I mean, you talk about a town with 2,000 people and no running water. They're hurting. When we came back to the United States, my parents identified a very similar population right under our own roofs here in America, and it was people struggling with addiction. They had horrible reputations. They were ostracized by society. They had very minimalistic resources in most cases because of what addiction had taken from them and nowhere to go. And they started a treatment program. And when I was about 8 or 9 years old, I started working there, you know, helping out here and there. And I ended up being there for a decade and a half as my parents built this into what ultimately became a very large one. And I will say there was a holistic changeover in mindset over that 15 plus year period within the addiction treatment industry. When we first started, we understood addiction as a behavioral disorder, bad choices, and it manifests with biological, psychological, social, and spiritual manifestations. But when you don't understand the biology, you leverage in on those other three. And these were people that we understood had depression and anxiety and PTSD. And if we address those things, maybe addiction would go away, right? Doesn't work that way. We saw them as spiritual people. This was a faith-based program. And, you know, if we could restore that faith back in God, their higher power, if we could help with their sense of purpose, and if we could give them forgiveness, right? Maybe by handling those elements, we'd end addiction. Didn't work out that way. And then there was the social aspects, right? Maybe if we helped them with food security and housing security and got their kids back out of the child foster care system and helped them with their divorce paperwork, maybe they'd stop drinking, maybe they'd stop using. Didn't work that way. And the organization recognized this, and so did the industry. And what we started seeing, thanks to the opioid epidemic, was a huge amount of evidence coming out through the literature on the true drivers of addiction. And what we found, Roseanne, is that this is a biological disorder that manifests in all domains of life.
Oh, amen. I am like my heart is sinking as I remember I before we started, I had a very serious um, nicotine addiction. Like from morning till night, I needed medications to get off of it. And I loved Jesus, right?
Yeah.
And just the same thing as you're saying, that's what's causing the shame is like, well, it should cause everything. Praying should cause everything. I love you, Jesus. Help me figure this out. It should, and not until I understood, you know, years and years and years later, the the biological aspect? Did I become empowered to work at changing those things? So I'm sorry, I didn't mean to, but you just struck a very big chord with my heart about the spiritual aspect and where shame comes from. Yeah.
Roseanne, loving Jesus and being addicted are not mutually exclusive concepts. In fact, I've seen them merged more often in that population than any other group. A national survey found that 86% of people that enter a treatment program want God in their lives, want a faith-based component to it, because they know that one of the biggest parts of their existence is missing and they're disconnected. And I will tell you, even getting that into their life, more often than not, like most medical disorders, is not enough, right? Jesus will support you through it, but let's use science, let's use evidence, let's use counseling and social support. Let's use that Christian group to help get us back to recovery. It takes everyone.
Oh, amen, amen. Thank you for that. So let's dive into it. Let's go up. You have this beautiful diagram that takes us through the process of what's going on with the rewiring of your brain across the spectrum. I'm going to have you bring it up for the YouTube users, and then we will attach it as a link for those listening
Absolutely.
on the podcast.
Can you see my screen right now?
I can see your screen, yes.
All right. So many of our listeners, I'm sure, are familiar with the term substance use disorder. This is a phrase that you're going to see largely used within the clinical community. And oftentimes, in fact, more often than not, you're starting to see it replace the word addiction. And I can tell you, I have strong concerns with that from a medical perspective. When we think of the word substance use disorder, that comes from our billing practices. Substance use disorder is a diagnostic criteria, a diagnostic code that we use to send off a bill when you show up to our office. And we use mild, moderate to severe scoring criteria to know exactly what interventions might work best for you. But all of it is based on something called DSM-5 criteria. And that's when we sit a person down, and a counselor or someone that's licensed to perform an assessment would go through all of these behavioral, I want to repeat that, behavioral manifestations of addiction, of an underlying compulsion, right? Cravings, control related problem. Well, let's start thinking about what these things are that we're assessing, right? Do you have secondary consequences related to substance use? Well, yeah, I crashed my car last week. Do you continue to use despite interpersonal problems? Well, yeah, my mom yelled at me last week when I went out partying, and yeah, there was alcohol there, and I shouldn't be doing it because I'm 17. Do you have problems with cravings? Well, yeah, I really want to go out. All my friends are there. Do you have problems not thinking about this? Well, yeah, everyone's doing it and I feel left out. I mean, I've just listed some examples that are going to score you, right? A score of 2 to 3 plus for a substance use disorder. Now, the more we've recognized the world of biology, the more we've realized that it truly is chronic exposure over time, typically weeks to months, before we start seeing these neurocognitive changes that we're going to talk about today that lead to a state of addiction. Addiction is a brain disorder. It is a rewiring problem of major centers in the brain that cause long-term complications in people. All substance use disorders do not represent addiction. And so this is why I want to make the distinction today. As we look at the image here, I've got something pulled up. It's called a heat map. So if our audience knows what a heat map is, the darker the color, the more of something there is present. And this heat map represents substance use disorders with milder versions on the left and kind of that white, yellow, hazy field all the way down to red on the right. And as you can see here, I've got that blue arrow on the right leading to a state of addiction. Not all substance use disorders are addiction. And if we look over here on the left-hand side for this mild, there are very minimal changes that'll still score you a couple points on this scoring scale. We treat early substance use disorders in many people differently than we do full status addiction, which is often that moderate to severe scoring system for substance use disorders. We've recognized three major pathways that put you on the track to addiction. And I want to go over these briefly, but the first one you see here is recreational use. So this is what our kids are doing, right? This is that kid who went out partying, he crashed the car. There's a point. He keeps thinking about it because all his friends are doing it and he wants to be a part of it. And it did taste good. There's a point, right? There's a score of 2 for this kid. This kid is not addicted. This kid needs mom to sit him down, say, you're not driving the car for a month and a half, you have no cell phone, and we're going to put you in counseling because we need family therapy sessions to really dive deep into why we're seeing these behaviors. We're going to create contingency action plans, right? The next time we see a bad behavior, something else happens. Recreational use over time can lead to addiction. And this is how we're seeing so many of our streets flooded with fentanyl, right? The chronic exposure pathway, this is a big one, Roseanne. These are individuals who don't necessarily experience a high during exposure. If we go back to the opioid epidemic, I want to think back, 2000s into that 2010 era. These are people that would come to the doctor with a legitimate medical problem, right? I fractured a leg, and without thinking twice, that doctor would hand over an opioid prescription. We wouldn't pre-screen that person for a history of other addictions. We wouldn't monitor them while on therapy. We wouldn't look for adjunctive therapies to add on. And week by week, month by month, if we keep refilling these, that person over time could experience changes in the brain that change their patterns of behavior and put them on the path to full-blown addiction. That person never got a high with this drug. They were overexposed. And then we see a new one here, this chemical coping pathway. A lot of this comes out of life trauma. So PTSD, mental health issues. Your wife died a week and a half ago, and now you got cellulitis on your leg and it hurts, and you show up to your doctor's office and you get that opioid, right? Well, that opioid just happened to not just take away your pain, but take away your anxiety. It takes away your depression, and it worked. And it works the next time you take it, and the next time you take it. And when that leg doesn't hurt anymore, you take it again. These drugs are miracle workers for mental health disorders in many cases until they themselves become the problem, and it is inevitable. And
And
over
as is
time,
alcohol, right? Because that's
absolutely,
what I'm
absolutely.
seeing is especially with the advent of COVID,
Yep.
they're using the substance as a medication to solve for their anxiety. And by the way, it's socially acceptable, it's encouraged, it's, take the recreational use and just drop it down to the chemical coping
Yep.
immediately, given COVID or any other extraordinary event like the death of a family member or whatever there is. So yeah, I hear you on that one.
You
But
nailed it.
yeah.
And all roads lead to Rome, inevitably. I would say with the chronic exposure pathway, not everyone develops addiction. The AMA says between 3 to 19% of people that have that chronic exposure that are taking these drugs for legitimate purposes. So benzodiazepines, similar to the mechanism of action for alcohol, will develop that. But it's a setup over time, and who would risk it?
And I think what I love about this conversation is the understanding that if you continue, this is the track. This heat map is a great visual for not a problem getting darker, darker, darker red. And that's what I'm trying to say is like, why didn't anybody tell me? And it's just like the cigarettes, right? When I was young, it was the Marlboro Man and the Virginia Slim Woman, and those companies could even advertise that your doctor recommended Camel Ice, right? I had no idea what I was getting into. People have no idea when they're going to cross over what I like to call the invisible line of not a problem, problem. People don't use alcohol or pain relievers, opioids with their doctors. They don't use it to believe they're going to get themselves in trouble. But with this education, they can at least say, whoa, I don't want that. I'm going to be careful. And that's, again, doesn't matter if it's an opioid or alcohol or any, marijuana for that matter in these days. So we have to be careful because the mechanisms are the same. What is going on in the brain? I mean, your description in the book of neural pathways being created was just excellent. If you could just talk a little bit about how the brain is being rewired, and I believe you used some examples like, it's a rocky dirt road to a super highway type thing that transmits. Could you just talk a little bit about how that is happening over this process and this spectrum?
Absolutely. If we go back to my days before I got into the medical field and was working mostly in this behavioral health field, my personal understanding of how the brain work was extremely minimal, right? It's this giant panellinguini and it's got some connections going here and there, but it's not got discrete zones. It's all the same chemicals flowing back and forth, and maybe it's adaptable to a degree. It was minimalistic, right? What we really know about the brain is that it's the most complex organ probably in existence on our planet right now. It's unbelievable. It's got more connections in it than there are stars in the Milky Way galaxy. There's hundreds of trillions. It's got functionality with discrete zones throughout the brain that have very specific job functions. This is why you get specific manifestations for strokes in different places. And the way these different parts of the brain communicate are on very, very specific pathways with stop signs and freeway lights and I don't know, highway lights. Freeways don't have lights. And dirt bike paths going one direction. It is highly, highly organized. And then there's very discrete cars, neurotransmitters, as we call them, that get on these roads and go between these different parts of the brain. And these different kinds of cars carry different packages with chemical signals that tell different parts of the brains go, no go for the next step. Neurologists spend their careers trying to understand the brain. And I will say our understanding of it is still tip of the iceberg compared to its true capabilities that I'm sure one day we'll have a better knowledge of. When it comes to addiction, there are multiple zones involved, but the biggest one is right in the middle of the brain, and it is your pleasure center, your nucleus accumbens, your ventral pallidum, as we call it. That pleasure center of the brain has got one job: make you feel happy, give you euphoria, as we call it, or that pleasurable sensation. When chemicals float up to that part of the brain, they trigger a reaction that allows for the neurotransmitter dopamine to float between cells and carry on that transmission signal. Dopamine is our happy chemical for everything. When you go for a walk, right, and it's a beautiful day, you get a little surge of dopamine. When you eat ice cream, you get a surge of dopamine, right? When your favorite elected official loses, your dopamine goes down. It entirely depends on what you're experiencing externally that manifests internally within the brain. Dopamine is normal. And what we've recognized is that that pathway is hijacked in all forms of substance use disorder: opioids, amphetamines, cannabis, tobacco, alcohol, all use the dopamine pathway. Now, other parts of the brain are affected. And going back to your earlier question, when we asked what do these different drugs do to the brain that are different, it really is those other components. I know we were talking a bit about alcohol. And when we go back to the concept of alcohol use disorder deals with other parts of the brain that turn the brain on and off from essentially a sleep or sedate to a very awakened state. GABA and glutamate are those two main neurotransmitters that we think about with that. They still use the dopamine pathway to create that passage of recurrent use. What happens over time? A good example is in the world of opioid use disorder, because we've really understood that better than probably any of the other substance use disorders from a neurobiology standpoint, given its more recent imaging studies, is that with recurrent use, we start hijacking these pathways such that what were originally 6-lane freeways going bidirectionally between different parts of the brain are overrun and are turned into dirt lane bike paths. What should have been the frontal cortex, that decision-making go, no go part of the brain, has transformed over to really being relegated minimal responsibilities and your pleasure center being in control. Then you've got your memory center of the brain, that part that remembers how bad you got yelled at when you crashed mom's car, how poorly you felt the last time you used. All those are hijacked. You have bad memories frequently, and you feel this state of ahedonia, this lack of pleasure. And then you've got your emotional processing centers, the amygdala, the part of the brain. That's greatly hijacked. They've done studies that show that your cortisol levels are just through the roof in that. You're anxious all the time. And this disequilibrium is largely driven by repeated exposure. They did studies on rats a few years ago, and they looked at what happened to those dopamine surges when rats were exposed to chemicals of abuse. And when they first did little rat, happy food, I don't know, a rat feeding tray, they noticed that the dopamine levels went up about 50% of what was normal we put out for those rats, right? That's normal, that's therapeutic. Amphetamine was 1,000% increase in dopamine output. Opioids, they did morphine, 400% increase. And you can see with repeated exposure, time after time after time, that's when we start seeing these changes in the brain. I get questions frequently, well, how long is it? It really depends on the drug of abuse. They did a study that looked at the risk of addiction in amphetamines and cocaine, and it was the highest risk out of all the potential substances out there. That's going to be literally weeks before you've got a lot of these fulminant changes in the brain. Whereas something like PCP or ketamine is going to take a lot longer. And we think there's biological components to this as well, mental health disorders and other things that play into it that makes it a very unique experience for every person.
Dr. Geyer, I'm going to ask you to stop sharing because I want to see us, and I think people got the idea of this. We'll keep going up the ladder because we need to
Absolutely.
get the stop share button.
Right there.
Okay, there we go. We're back. Yeah, and I'm recognizing, and I even because of my addictive past with both the nicotine and the alcohol, I'm feeling you. The anxiety, the lot you drink to reduce anxiety and it creates more. Yeah, you drink to calm yourself down and you're more irritable. It's I call it the massive lie of the substance. But so we keep going down this path, and I think this is important for the population that I deal with. I'm dealing with a population that's all across the spectrum, right? And I also deal with a population that's post rehab, and I want people to understand these highways keep getting hijacked and it keeps getting worse. And so one of my questions to people is, how long have you been dealing with this? 3 years, 5 years? For me, it was 10 as I graduated up the ladder. And I don't know where my alcohol use disorder was. I didn't need medical intervention, so just severe, I suppose. Um, Whereas with my nicotine, I did need medical intervention. Um, but I'm like, well, how much longer do you want to keep dealing with this? I need you to understand that the hijacking continues. So let's keep going down the pathway and find out what happens. I love this.
The more you use, the harder it is to stop. The brain is really good at cementing in pathways, and it's going to take the path of least resistance to make connections. We've got some amazing images that show this reworking, this hijacking of the brain, and how these connections look so different in a person that hasn't had a history of substance abuse versus someone that's currently abstinent with a history of substance use disorder. That's concerning. One of the best studies that was done a couple of years ago looked at the heroin brain in an abstinent person, and all of these connectivity patterns were persistent upwards of 15 years out from their last use. The reason I say that's important, because you can be in a state of recovery and still have these brain changes, is that you're at risk for relapse. And this is why the American Society of Addiction Medicine recognizes addiction as a chronic relapsing disorder. If we were to put this in perspective of another medical disorder like diabetes, right? So diabetes is caused by the insulin coming out of the pancreas and trying to get into those cells to carry that sugar in. And in most cases of type 2, just not doing a good enough job. And then you get these high elevated levels of blood sugar in your body. Well, that hardens your arteries and it shuts down your kidneys and you get vascular changes in the brain. It's badness. All these changes to the body from high blood sugar can be permanent. Even if you get your weight down, you lose 20 pounds, you get on great medications, and you're on some insulin, and your blood sugars are now well controlled, you've got permanent changes in your body. And that's what we see with addiction. We might be able, in many cases, to restore the transmitter levels in the brain that were off when someone is abstinent. In fact, there's good data to support that, at least for opioids. The changes in the brain for rewiring, we don't know how long they last, but the right answer is a very long time. And this is why someone with any history of addiction who's been rewired, right? That's what addiction is, who shows up to a healthcare system and needs an opioid or needs a benzodiazepine or another controlled substance with addiction potential, we want to screen for that because all we're doing is putting new cars on freeways already built.
Yeah, it's interesting that you say that because I've certainly had a lot of opioids prescribed to me under different legitimate reasons. Luckily, I hate the impact of them,
Yeah.
so I try and get off them as quickly as possible. So I didn't have that transfer, but I do see a lot of transfer. I see a lot of transfer, as a matter of fact, from opioids to alcohol because they're they're like, okay, I can't do that anymore. Let me try this. And it's like, whoa, same pathway is going to be engaged. Um, I like to provide hope, though, in terms of these permanent pathways. And I love the diabetes example because I tell people that, look, you have a choice. You now are empowered to understand how your body works. And the same with if I engage in bad eating habits, I'm going to have consequence in my body, right? And if I engage in a substance again, I'm going to go back to this life I hated.
Mhm.
You have the evidence of your choice, and let's just choose us. Let's choose our brains. Let's choose health, and and I am a big proponent of, well, of course, faith-based, follow God, and because he has the wisdom and guidance to keep us on the right path, keep choosing something good for us, not something that harms us or other people. And so, while I tell people, sure, I have the romanticism of it, but it lasts for a second. I don't want people to think that it's the physical pain that you might have experienced in the front end. It's a moment where you get to process your choices and move on, and that's very much manageable and easy, even though it's there, right?
You nailed it. Roseanne, you brought up an interesting comment about eating, right? And in our treatment program that my parents ran, we saw an interesting phenomenon. In our female population, primarily, all these women who had a strong history of addiction would come through the program. And they noticed early on that these women were gaining upwards of 30 to 50 pounds, oftentimes, despite being abstinence of the substance of abuse. And what had happened? Well, one addiction had transferred to another. And one thing I would very much caution our audience, if they're receiving this advice, is that transfer of addiction philosophy. We see a lot of it out there, right? It's don't use drugs, find something you're really passionate about and put all your energy into that. That's been exercise, that's been marathons, that what we're really doing, Roseanne, is taking our problems with the original four C's and putting them into a new arena. The four C's are the manifestations of addiction, the problem with cravings, control, consequences, and compulsion. Cravings, control, consequences, and compulsion. We've moved to something non-chemical. We have people that were drinking more Mountain Dews than you could count that came in through the program. They just transferred, right,
Right.
to a new high. They were going out on their weekend passes and they were riding every roller coaster in the state. They want the thrill, they want the dopamine surge. And that's the problem. They want the runner's high, they want the food euphoria, they want the excitement. All drugs of abuse use the dopamine pathway. All non-drugs of abuse, I'm sorry, non drugs that cause for euphoria use the dopamine pathway. And we're recognizing that in the addiction field, right? So this is sexual addiction, phone addictions, technology addictions, same thing. And so what we're seeing is this transition over in our world to really focusing on the rest and relaxation, that serotonin neurotransmitter that says, you know what, sitting and watching a sunrise is an okay thing. Walking through my day and vacuuming my carpet
Beautiful. Yeah.
and saying, this is okay. I don't need to be chasing the next high, right? Focusing on what serotonin does, which is your mood, your memory, your sleep, and your emotional stability is where we need to see that transition. So if you're in a program or a group that's recommending you dive into the next thing to challenge your addictions to something else, that is not recovery. That is a setup for the next problem, which could be a chemical and that could be
Well,
life-threatening.
caveat, because I do say find the person you were created to be, because
I like
that
that.
that produces true God-given joy.
Yeah.
So if you were an artist, you have artistic talent, but you never pursue it. If you love to bowl, pursue bowling. God will find a purpose in all of these things that create true joy in your life. And I love that you've touched on this too, because my most recent thing is recognizing what causes calm in my central nervous system. Because one of the things that I've noticed post substance use is the calmness. And I search it out. I search it out in my reading of the Bible in the morning, of spending time with God, of praying. Those are the things that I'm after, is calming my central nervous system and enjoying life and finding purpose. And so we can transfer to those things, right?
Absolutely. If this does not control your life, right? If you're not craving it 24/7 to the point that you're abandoning everything else in it, if it doesn't consume all of your time, then you're on the right path,
Amen.
right? And
Yeah.
I would put the caveat too, you know, I believe God is the restorer, the healer, the builder of our lives. We are malleable beings and we are infallible. We fall apart, right? The reality is that these bodies weren't meant forever.
Yeah.
So with that understanding, with what you've got to work with right now, if you're chasing him, you're probably on the right path.
Yeah, thank you. Yeah, I was gonna ask you about that too. The three of the things in your book. Well, we talked about how to well, maybe you can touch on this. We're running out of time, but the three things I wanted to talk about that were how do we help people heal? One of the things in your book was rewiring the brain. So maybe we can talk a little bit about how to do that. Another thing you talked about that I definitely keyed into is the power of positivity, because when you are in a substance nightmare, it's hard to be positive about anything. And then how important is spirituality? So how do you rewire the brain? How does positivity and spirituality work inside those things?
So the rewiring we touched on a bit. We know there is a persistence in the available clinical research world of all of these changes. How long they last, we don't know. We do recognize that standard licensed interventions that have been well studied. So these are things like motivational interviewing, other counseling modalities have been shown to help rewire the brain. They augment that neuroplasticity in the parts of the brain that really should be well connected, especially that frontal lobe, taking back control over your decision making. Getting counseling is key. And I would really encourage our audience to seek it out from a licensed professional. They are trained on how to do this well. I will say I see my share of people who get it from peer support specialists, from non-licensed people. It's an emerging field. You don't need a license to offer support. We just don't have the data to back up them essentially leading to long-term changes within the brain. So I would encourage that. In terms of the changes that we see in spirituality, there was a great study that was done a number of years ago. And the study was evaluating what people wanted when they came to a treatment program versus what we, as the treatment program, thought you needed. And so they took these clients come in and they said, okay, what do you think is the most important aspect to you recovering when you walk through our doors? And they're listing God, right? Support from a community, personal purpose. Those were the top ones. And then, things way down the list, medical care, medications, counseling. So then they flipped it over to the doctors and they said, okay, what do you think that these people need? Oh, well, they need housing security, and then they need medications, and then they need counseling, and then they need psychiatric support. And then, the list.
Interesting. Yeah.
And then they asked those doctors again, and they said, what do you think the client thinks? Well, we don't get our clients. We screwed this up, and we flipped it over again to exactly what we were thinking. The reality is that spirituality is so important to people. And I won't get into the nuances for our audience today as to how that's defined, but we do recognize that a recognition of a higher power, in my personal life, that's Jesus Christ, is one of the most important things that gives people purpose and meaning and hope. And I've seen that change people's lives far more so than I've seen any other intervention. And I mean that.
No.
And that comes down to the power of positivity too. When you've got a reason to have hope, you engage in it. And I would tell audiences that there have been national studies done on 2 occasions in the United States, and they've been recent. They did cross-sectional evaluations of people across the US, asking them, have you ever struggled with a substance use disorder, and how many of you have achieved recovery? And you know what the number was? 75%. 75% are leading full lives who've struggled with addiction. It's there, it's attainable.
7.5?
7.5. Yep,
Yeah, okay.
75%.
I want that study. I've been quoting like 11 or 17.
No, no, 75%. Yep. There was another study that was 85%, but I think it was less quality literature.
Yeah, I believe it, but what can I do? I have to go with the science, right? And I'm like, oh, there's so much more to this, because I wasn't self-reporting. I wasn't self-reporting to counselors, psychologists, pastors, anyone. And I was just hiding because and I'm not sure you know about my story, but I was really opposed to this 12-step approach because of the labeling and the stigma and the lifetime sentence and the focus on character defects. I'm like, we're all broken. Why do I have to step over here and be extra broken? And I don't want to be extra broken. So yeah, Jesus is the answer. But the one thing that the 12-step programs, I've talked to hundreds of people, right, that have gone through them, and it's what is the primary thing that they solve for? One is a community of not feeling alone.
Yeah.
And yeah, and I think that's the primary thing, somebody to talk to openly about it. And that's what you and I are trying to do, right? Let's just talk openly about it. I have a problem with chocolate cake far worse than I have a problem with alcohol or cigarettes. Like,
You're in good company.
let's just level the playing field about choices, right? Because we all have them and there's consequences to them. And
Right.
yeah, well,
You have a friend or loved one who goes through cancer treatment and they come out of it with a badge of honor, right? And the family fills the room and everyone's excited and mom, you can do this. I round on patients 2 doors down who struggle with addiction and those rooms are empty. There's such a stigma and a misunderstanding, Roseanne, on what this is. The reality is, like you mentioned, that 12-step program does something that we should be doing every single day of our lives, and that's self-reflection. But that program forces it on its participants, as opposed to all of us who would rather pick up a cell phone or watch the next episode of who knows what, who ignore that ability to sit down and say, what are the problems in my life? Because I can guarantee you, It doesn't have to be addiction. You have them somewhere else.
Mhm.
And one of the lectures I give nationally is on the topic of people returning to the workplace with addiction. And the studies are in the favor of people who've struggled with addiction as being more engaged in the workplace, better, more reliable employees. You guys come out with life skills that nobody else has. So wear that badge of honor, Roseanne. I mean
Yeah.
it.
Oh, I think people who have been addicted to something are the best disciple makers in the world,
Couldn't agree more.
because
Could not.
the verses scream out at us. At least that's my experience. All right. Well, this is. Did we miss anything that you would love people to know about? How do people? They want to know more about how to follow you. Whether the book is on Amazon. I got it on Amazon. Ending the Crisis. Um, the stage is yours for the next few minutes on anything you'd like to share about that maybe we didn't share, or how to just continue to get educated on this.
I think we covered a lot of good topics today related to that biology and understanding the disorder so as not to feel that stigmatizing, language that comes from society. I do see future opportunities to really talk into what to do in the medical field if you are re-exposed to these potential drugs of abuse. And that's one of the areas I highlight in my world of opioid stewardship. How do we keep you safe? Because you're going to have pain. You're going to have a car accident, two of them in life. you know, Uh, what do we do on behalf of it to protect you and not necessarily use us as the middleman to give you that information? That's the reason I wrote that book. The first half of it is what is pain? What is chronic pain? And why are opioids generally not appropriate? What changes in the brain with chronic pain? How to use these drugs safely? What are alternatives? And then what to do if you experience consequences, particularly with that opioid class. How do you as family members navigate people out all the way from interventions to finding the right people through your insurance company to finding standard of care treatment programs? And I would caution our entire audience, Roseanne, there is a lot of what I would distinguish as fraudulent
Mhm.
practices out there that do not offer standard of care treatment, and more money for a program does not equate to better outcomes
Yeah,
in most cases.
I couldn't agree with you more. Couldn't agree with you more. And we have a mental health crisis, and people need access to care too. And that's uh, that's the challenge, is finding the right access. But hopefully, there's a lot of people like you who are. I just tell people, find an addiction specialist, find an well, you're dealing again in the opioids. Mine is alcohol, so find somebody that deals with the PTSD. You would say find somebody qualified to understand how to um, medically get you out of this crisis. So because it's dangerous, it's life threatening.
Well, that I think is another good podcast talk, Roseanne. I think going through what are the elements of standard of care treatment for addiction, regardless of what the addiction is to. There's a lot of key points I think people need to know about.
Yeah, well, thank you for your time. I really appreciate it. I know you're a busy lady speaking all over the country, so I appreciate you taking the time to explain all the things you did today.
Absolutely. Thanks for having me on, Roseanne.